We're going over the Eli Lilly versus Empower lawsuit that was filed on April 1st over compounding GLP-1, so you don't have to. This part is about factual allegations. Yes, it is a little bit about safety for sure. That is their defense, but they are not calling it out as unsafe. They are saying like their defense is like, it could be unsafe because they've had violations. Well, so is the FDA given violations to Eli Lilly as well. So kind of null and void on the safety landscape. That is more of like a possibility, but the like causal, like feet on the floor reason is trademark infringement. So let us get into drug compounding. Section 31, they define compounding: a practice in which licensed pharmacist, physician, outsourcing facility under the supervision of a licensed pharmacist makes individualized medicine. An example that they give is if a patient is allergic to an ingredient in an FDA-approved medicine, the compounding pharmacy can produce a version of that medicine that doesn't contain allergens. Fun fact that I learned recently, a lot of compounding pharmacies make children's cancer drugs because they have to be so like specialized, because there's so many forms of cancer that are like super specialized, or kids have different compounding like things that need specific things. So this could also affect the supply of like cancer drugs for children as they define what a compound is, what a generic is, and who can compound what. Fun fact, side note. As in section 32, as FDA itself makes it clear, compounded drugs are not FDA approved. This means the FDA does not review compound drugs to evaluate their safety, effectiveness, or quality to reach their patients. However, they do inspect the facilities, they inspect the creation of it. They just don't have the clinical trial backing to get the quote-unquote FDA approval. Although the active ingredient trizepatide has FDA approval. It's kind of complicated, super weird. Stay with me. They go on to talk about how the FDA says that they can't guarantee the safety of compounded drugs. Very true. You need to make sure you're getting a compounded drug from a like licensed place that is under FDA regulation, just not like a random guy who's Breaking Bad in his basement or something like that. Definitely for sure. They can't guarantee that. Kind of a generalized statement if you ask me. We're going to do part 6, talking about section 34, 35, still about compounding drugs, their definition, and why they don't like them. Stay tuned.